What if the very people we trust to keep us healthy are hiding deadly secrets? From contaminated medicines to hospital cover-ups, the shocking truth about infection and health scandal allegations will make you question everything about the healthcare system. Stay with us as we reveal the darkest corners of medical deception. Segment 1: Understanding Infection and Health Scandals. Infections are a natural risk in hospitals and healthcare facilities, but when negligence, corruption, or deliberate malpractice is involved, they transform into full-blown health scandals. These scandals can range from contaminated medications, improperly sterilized surgical equipment, or unsafe medical procedures to deliberate cover-ups that hide outbreaks from the public. Health scandals often involve systemic failures within healthcare institutions, where patient safety is compromised for profit, convenience, or to protect reputations. For instance, when hospitals fail to follow basic hygiene protocols like hand washing, sterilizing instruments, or isolating infected patients, infections spread faster than expected. Globally, these scandals are not limited to one type of infection or one healthcare system. They reveal vulnerabilities in supply chains, quality control, and even governmental oversight. Such breaches of trust highlight the urgent need for accountability in healthcare. Segment 2: Famous cases of infection-related health scandals. 1. The 2010 heparin contamination scandal, USA. Heparin, a widely used blood thinner, was found to be contaminated with oversulfated chondroitin sulfate, causing severe allergic reactions, low blood pressure, and in some cases, death. The contamination originated from overseas manufacturers supplying raw materials to pharmaceutical companies. Investigations revealed that inadequate quality control and poor regulatory oversight allowed the contaminated drug to reach patients, emphasizing the dangers of globalized medicine without proper safeguards. 2. The 2012 blood contamination case, India. Thousands of patients, especially children, were infected with HIV and hepatitis C due to untested and contaminated blood transfusions. Hospitals ignored safety protocols, and regulatory bodies failed to enforce mandatory testing. The scandal sparked nationwide outrage, leading to investigations and legal reforms. It also raised questions about the ethical responsibilities of blood banks and hospitals in protecting vulnerable patients. 3. Hospital superbugs and MRSA outbreaks. Global. Hospital-acquired infections such as MRSA, methicillin-resistant Staphylococcus aureus, and C. difficile are often linked to poor sanitation, overcrowding, and overuse of antibiotics. In many cases, hospitals tried to conceal outbreaks to avoid lawsuits and maintain reputation. Patients unknowingly exposed to these superbugs often face prolonged illnesses, financial strain, and in severe cases, death. 4. The 2015 sterilization scandal, China. In one of the largest scandals, disposable surgical equipment was reused in multiple hospitals to cut costs. This led to widespread infections, including hepatitis and bacterial infections. Whistleblowers and investigative journalists brought the issue to light, forcing authorities to tighten regulations and impose stricter hospital inspections. These scandals prove that infections are not just accidents, they are often preventable consequences of negligence, corruption, or unethical practices. Segment 3: Causes behind health scandal allegations. Several interconnected factors contribute to infection and health scandals. Negligence. Hospital staff may ignore basic hygiene protocols due to workload pressures, insufficient training, or complacency. Failure to sterilize instruments, maintain clean facilities, or properly isolate infectious patients leads to outbreaks. Corruption, bribery, falsified records, and ignoring regulations are common in hospitals, pharmaceutical companies, and blood banks. Such unethical behavior directly jeopardizes patient safety. Poor regulation. Weak government oversight or delayed inspections allow substandard drugs, vaccines, and medical supplies to reach patients. Regulatory gaps are often exploited by profit-driven companies. Profit over safety. Pharmaceutical companies may cut corners to reduce costs, selling cheaper or falsified medications. Hospitals may reuse disposable equipment or skimp on sanitation to save money, directly endangering patients. Global supply chain vulnerabilities. With medicine manufacturing spread worldwide, contaminated raw materials can quickly enter multiple markets, affecting thousands or even millions. The combination of these factors creates an environment where preventable infections and scandals can occur, sometimes on a massive scale. Segment 4. Consequences of health scandals. The consequences of infection and health scandals are both immediate and far-reaching. Loss of trust. When patients discover that hospitals or health authorities have been negligent, trust in the entire healthcare system diminishes. Fear and skepticism can lead to people avoiding necessary medical care. Public health crisis. Contaminated medications, blood transfusions, or hospital-acquired infections can trigger widespread outbreaks. A single scandal can escalate into a national or even international health emergency. Legal repercussions. Healthcare providers, hospitals, and pharmaceutical companies face lawsuits, fines, and criminal investigations. Regulatory bodies are often criticized for failing to prevent scandals, prompting reforms. Financial burden. Treating infections caused by negligence is expensive. Patients often face unexpected medical costs while governments spend millions managing preventable crises. Emotional and psychological impact. Victims and their families suffer not only physically, but also emotionally, facing trauma and mistrust toward medical professionals. Segment 5. Preventive measures and solutions. Although the scale of health scandals may seem overwhelming, several measures can significantly reduce risk. Stricter regulation. Governments must enforce stringent quality checks for all drugs, vaccines, and medical equipment. Independent audits and international standards can prevent contaminated products from reaching patients. Transparency. Hospitals and health authorities must report infection outbreaks honestly. Transparency ensures accountability and helps prevent further spread. Patient awareness. Educating patients about hygiene, vaccination, and infection risks empowers them to make safer choices and demand better care. Technology integration. Digital tracking systems for drug distribution, hospital infection rates, and sterilization protocols reduce fraud and errors. Advanced diagnostic tools can quickly detect contamination or infection outbreaks. Ethical training for healthcare professionals. Medical staff should receive regular ethics and hygiene training to maintain safety standards and avoid negligence. Implementing these measures not only prevents infections, but also strengthens public confidence in healthcare systems. Segment 6. How to protect yourself as a patient. Even with preventive measures, patients play a crucial role in protecting themselves. Verify the authenticity of all medicines, vaccines, and supplements. Check hospital infection control policies and hygiene standards before procedures. Be aware of common hospital-acquired infections such as MRSA or C. difficile. Ask questions about procedures, sterilization methods, and test results. Report suspicious activity to health authorities or regulatory bodies. Being proactive and informed can significantly reduce personal risk, especially in places where oversight may be lacking. Segment 7. The role of media and whistleblowers. Media and whistleblowers are vital in exposing health scandals. Many major outbreaks and contamination cases were revealed by insiders risking their careers to report negligence. Investigative journalism shines a light on corruption, forcing hospitals, regulators, and governments to take corrective action. Without such oversight, many scandals would remain hidden, continuing to put patients at risk. Society must value and protect whistleblowers and encourage investigative reporting in healthcare. Segment 8. Global perspective and lessons learned. Infection and health scandals are a global issue affecting both developed and developing countries. Examples range from contaminated blood in India, reused surgical tools in China, and hospital superbug outbreaks in Europe and the USA. Common lessons emerge from these incidents. Systemic accountability is essential for patient safety. Patient education empowers people to identify risks and demand proper care. International collaboration can prevent contaminated medical products from spreading globally. Ethical governance and regulatory enforcement reduce preventable harm. The repeated occurrence of such scandals underscores the need for vigilance, transparency, and ethical responsibility worldwide. Thanks for watching. If you enjoyed this, don't forget to hit like, share, and subscribe for more amazing content.